Hey guys, Oscar here with Gastroenterology Simplified. I'm a board certified physician assistant, and today we are going to talk about hypothyroidism and hyperthyroidism in the GI world. Before we go any further, I need to make this clear. This video is for educational purposes only. If you have any questions or concerns, please contact your primary care physician or your physician assistant. So let's go ahead and talk about hyperthyroidism. Hyperthyroidism in the GI world will give you appetite change, meaning your appetite is going to increase. And this makes sense because your thyroid gland is just working, and your metabolism is going 1,000 miles per hour. Then we have something very important, which is diarrhea. Before we blame diarrhea on hyperthyroidism, we need to make sure that the patient does not have an infection. So very, very important. Some of the most common infection could be food poisoning versus viral infection versus C. diff, just to mention a few. Another thing, fatigue. We need to make sure that we have a iron deficiency anemia workup before we blame it on the hyperthyroidism. Weakness, same thing. And usually the patient will have weight loss. And this makes sense because the gland is just working, and the metabolism is just going 1,000 miles an hour, and you can't have enough calories, therefore you have weight loss. Now let's move on to hypothyroidism. Hypothyroidism is somewhat of the opposite. In hypothyroidism, in the GI world, the patient usually have appetite change, and sometimes their appetite is low. All right. Also, constipation. Before we blame constipation on hypothyroidism, we need to make sure that the patient is not taking some type of medication that causes constipation, like, for example, opioids or some antidepressants, just to mention a few. But we need to make sure that we have that workup first before we blame it on hypothyroidism. And another thing that goes along with hypothyroidism is weight gain. And this makes sense as well because your metabolism is very slow. It's very, very slow. Your GI system is low. Therefore, you're going to have weight gain because you continue to eat and you're not burning enough calories. Therefore, you have weight gain. Also, with the constipation, your GI system is very slow. So it takes longer for the patient to have a bowel movement. Therefore, that's why sometimes we have constipation. But we need to make sure that we don't blame the constipation on just the hypothyroidism, because we need to go ahead and take a look at the medications. We need to take a look at other issues that the patient may have before we blame constipation on hypothyroidism. So we have this clear. Hyperthyroidism gives you increased appetite, diarrhea, fatigue, weakness, weight loss. Hypothyroidism gives you decrease in appetite, constipation, weight gain. Also, you can see fatigue with hypothyroidism. So in conclusion here, hypothyroidism and hyperthyroidism, yes, it could affect your GI system, and this is the way it affects your GI system. If you found this video interesting, click like, subscribe, and please share the video. And if you want to see other videos, click right on this video.